A young woman, all of the age of 30 years, came to our clinic with the chief complaint of pain in all of her teeth. It's typically unheard of that you complain of pain throughout your mouth and throughout the day. Recently, in the past 2 weeks, her removable retainer kind of broke. Towards the end of the appointment, when I had actually honestly given up, that I am not able to find the right association with the pain and the right reason why she's having this pain. When one of the last questions that I ended up asking her was that, are you just with this, I noticed that her eyes moistened and she looked down and she had a faint smile and she said, so, hi, today I want to discuss about a very different case that we encountered in our clinic in the recent past. A young woman, all of the age of 30 years, came to our clinic with the chief complaint of pain in all of her teeth throughout the day. Now, as a dentist, you find this funny because when patients come with a very deep cavity, they have a certain kind of a pain. When they come with a impacted wisdom tooth, they have a different kind of a pain. It's typically unheard of that you complain of pain throughout your mouth and throughout the day in all of your teeth. So we tried to examine her deeply. We took some x-rays, full mouth x-rays, to understand this better. Barring a little bit of tartar here and there, we actually couldn't come to any great reason as to why she was experiencing this pain. We spent a lot of time in understanding the past history. She had undergone aligners, so she treatment which completed about 2 years ago, and she's been wearing both a removable as well as a permanent retainer post her aligner treatment. Recently, in the past 2 weeks, her removable retainer kind of broke, is what the patient told us. On examination, we went deeper. We understood that she does have several fillings done, but the fillings all looked great. They weren't really pointing towards anything that was wrong. Even on the x-rays, yes, there were some impacted wisdom teeth, but I knew for a fact that those were not the ones that were causing the pain. So we didn't want to rush into a diagnosis or a treatment, and rather what we did is we spent a lot of time in understanding what was the trigger of this pain, when did it start, what was the history of her dental, treatments like, and getting to kind of get to know the patient more personally. And after spending a lot of time with her, towards the end of the appointment, when I had actually honestly given up, that I am not able to find the right association with the pain and the right reason why she's having this pain, the correct diagnosis, and therefore I was not able to come up with a treatment plan, and I was almost giving up. When one of the last questions that I ended up asking her was that, are you under any stress? Now, just with this, I noticed that her eyes moistened and she looked down and she had a faint smile and she said, who is not going through any stress in their life? But that's when I realized that her retainers that she was using post her aligner treatment were actually working as mouth guards. And she then, towards the end of her appointment, after spending so much time with her, she then told us that she gave us a history of Bruxism. Bruxism is basically a habit that patients who undergo a lot of stress have, because of which they end up clenching their teeth a lot. And that constant clenching of the teeth causes a lot of pain in the muscles surrounding the teeth, which present itself as pain in the teeth. But she tells me that, I've been clenching since a child, and this is a habit that I've had since childhood, and it's never really caused a problem. And it's only recently that it's causing a problem. And that's when I connected the dots and I realized that her retainer that she has been wearing post her aligner treatment has actually been working as a night guard for her. A night guard is essentially a transparent mouth guard which you snap onto your teeth before you sleep, so that this bruxism, this clenching of teeth, which most commonly happens during the night, tends to stop. That mouth guard tends to create a gap between your upper and lower teeth so that you don't constantly end up bruxing or clenching your teeth. And that's it. So basically, we finally came to the diagnosis that she is a bruxer. She needs to just simply get her night guard made, and it is nothing more than stress that is creating this kind of a problem. And this would not have happened. I would not have been able to come to this diagnosis had I not spent that kind of time with her, had I not understood the entire history in detail, because sometimes patients, she ended up associating her pain with her aligner treatment and thought that there was something wrong. Sometimes patients come with a very set frame of mind that this could be the reason why I'm having this problem and this could be the solution. We as doctors cannot get carried away with that. We have to stand our ground and understand very, very deeply the history and understand the patient more personally to be able to come up with the right kind of diagnosis for the patient, not rush to extract that wisdom tooth just because it may be causing pain, or not rush to repeat an old filling because we feel like there may be some underneath, there may be some cavities underneath the fillings. But we need to spend this kind of time to understand our patients more personally, so that these underlying issues that we do not actually give too much importance to. I know it's very common to say that most of our manifestations of pain through the body is actually associated with stress these days. So we also need to understand that a dental pain could also be, a manifestation of stress. And this is something that we should not take very lightly, and we should spend that kind of time with our patients to come up with the right diagnosis and treatment plan for them.